Good afternoon.
My name is Devang Shah. Maybe some of you are little newer faces, so I would like to give a short introduction of who I am and what I am doing right now. My specialization is into yoga therapy. It is the actual application of yogic techniques, that is in particular asana, pranayam, different mudras and all, for all the curing of the different kind of ailments. So I've been working in this field since last 14 years now, and my qualification into yogic field was from Bihar School of Yoga, then SVSA, that is the Yoga University.
I also come from Bihar School.
Oh, great. Okay. So all such places, they are wonderful places to learn in depth into the yogic science. And lately I've been working with this KJ Somaya College in Caregiver. And I'm a faculty there working for the applied yogic sciences, as well as I'm working for Bombay Hospital for the Parkinson Society. That's also a neurological problem, as you see, Parkinson. And also I'm working for Indian Navy and certain other organizations for the development of I'm a faculty yoga therapist, training the Parkinson patients for better management of the disease.
I think a lot of people have been almost cured nowadays. I don't know, Parkinson's. I know a lot of people who have been cured.
Yeah.
They've been healed. I won't say cured, healed.
Yeah, exactly. Better managed. Because nowadays people are much more aware. They know what to expect. They know what to do. So if they are enthusiastic enough, they can definitely overcome most of the health problems if they are going into the right direction of the management. So that was one of my aim for working for the yogic application, how yoga as such can be useful in a scientific way. So let us see today's topic, that is Alzheimer's. You must have some or the other time come across this word, Alzheimer's. So in a short introduction, it's a progressive disease. It's a slow progressive disease. Alzheimer's is a problem disease, means so many times you must have heard that as the age grows old, there are some of the common symptoms that are seen, that is something like a forgetfulness or not able to put together certain events, things, situations or to act appropriately. So as the age grows, the mental faculties, all the mental functions, they are deteriorating. Okay, we will call them the cognition part. Cognition part matlab ज्ञात होना हिंदी में. ज्ञात होना matlab it can be a situation, it can be an event, it can be the present event or a memory. Certain everything will come under it. So it's a progressive disease. Once it starts, it just goes on becoming more and more difficult to cure and more into the problem. And it is mainly affecting the nervous system, and the main important functions that will be affected, which are seen, are the memory, which is getting maximum of the effect. Then is the reasoning, the planning, language and perception. Perception is again to be able to know the things around, right? All these things are affected in this Alzheimer's. Secondly, it is also part of the, commonly these things are coming under the dementia. Dementia matlab the memory loss. Any kind of a memory loss, there are different causes and types of also dementia. Parkinson is one of the biggest cause of the memory loss. That is the dementia. And so most of the time this Alzheimer is terminating. That means it will go and end up with the death only. So there is no as such like a curative aspect till now available with the modern science. So we will just see how the actual degeneration or the disease is progressing. We will be understanding today's this workshop into 2-3 different things. One is what is exactly this Alzheimer's disease. Secondly, what are the intervention possibilities? And thirdly, what exactly yogic part will be dealing into it. So we are right now in the first phase where the nervous system is getting affected. So how it gets affected, let us just have an idea. So as we are looking, this is the normal brain cells. This is how the neuron is a single brain cell, and it is having the connections to the next neuron. All the neurons are now, they are all interconnected. So this interconnectivity is the most important part in the neurons. Otherwise, it's like an individual cell which is having all the possibility, but if it is not having the connections, all these possibilities are actually useless. So you can see that generally if a message comes from one end of the neuron, it will get transferred to the next neuron, and then it will be transferred to the next and next, all the around neurons, and then the functioning will go on. If there is something to be processed, the neuron will process the information and then pass the thing further. Now this is a general function. What happens in the Alzheimer's? There is the neuron, there is the next neuron, and in between the connections between the neurons or the neuron body as such is getting affected. Okay. So how does it get affected? Let us just observe that. So etiology, that means why it is happening, it is still not exactly known, still not perfectly known that why the Alzheimer disease is occurring. But there are some of the risk factors. So risk factors means that is known that if you are doing this, then surely the possibility of getting the disease is much more. So one is the genetic part of it, that it is also part of the genetic. If the parents are having, if the grandparents are having, then the possibility is more that the person may have. Okay, it's not still sure that the person will have. That depends on all the factors that you can prevent it. Okay. Second is the environmental factor. So there are certain possible factors to which if you are exposed, then such problems to the to all this nervous system is increasingly much more. So let us see what are the risk factors. किन लोगों को ज़्यादा से ज़्यादा ये प्रॉब्लम होने की संभावना है? First is the age. 65 and above, there is more and more chance that the person will have this Alzheimer's problem. Second is the hypertension. Hypertension is the high blood pressure. It is continuously high, the blood pressure, so that the nervous system functioning also gets affected. Third is the cholesterol level. If the higher cholesterol levels are maintained, that too in particular the lower density apoproteins, if they are maintained very very high consistently, then that affects the chances of developing Alzheimer's much earlier. As here I have mentioned 65 years, there are people who have seen right from the age of 45 they are getting this problem. So nowadays the onset is much earlier as compared to before because of the lifestyle changes. There is also the coronary artery problem. So the heart problem, जहाँ पे the arteries are getting clogged because of the deposition of the different kind of these lipids and all. Also the cause is this diabetes is one of the biggest like a factor which will make it happen much more faster. So nowadays if you see all of these things, these are nowadays seen in the younger generation also. Blood pressure, diabetes, even in 20s, 30s, 40s people are seeing. Okay. So what are the other risk factors? As we have seen the genetics, also alcohol and the smoking. That is one of the major risk factors for so many diseases. Also there are some syndromes like Down syndrome and all, which will also be affecting this problem. Now if we see, this is the normal neuron, this is the body, and this is the axon. Axon takes the information further ahead, and this is the axon end. This is the synaptic terminal where it will get connected to the next dendrites of the next neuron. So this is how the information will keep on passing between the different cells. Now what happens exactly in this Alzheimer's? There are two kind of problems that are created in the neuron like a network. One is the plaques and another is the tangles. So these plaques and tangles will be formed. How it will be formed? Let us see. If this is the normal structure, there are some protein molecules. The protein molecules will be placed in between the neurons, right? First, they will be just like a deposition. Once there is some kind of a deposition, that protein molecules starts to shrink. It gets connected to all the neuron and around, and it starts to shrink. So that normal structure around the cell will also get affected. So that connection between so many neurons will be disturbed. Even the neuron cell actually will also get maximum effect. So what happens? That all the structures of the neuron that will be affected because the microtubules are there. There are some small microtubules. They are the structures of the neurons which will be highly affected because of the protein. Right? You can see this is part of the neuron, and these are the internal structures. So much of fine arrangement has been done by the nature. Now, if that is getting disrupted because of the protein, the binding doesn't happen. So the neuron functioning will be very much highly affected. Right? This is the normal healthy brain. As you will see that the structure of the brain, if there is an internal loss of the neuronal structure, then overall there will be a shrinking start happening. So as the AD goes on, that is the Alzheimer's disease, the shrinkage will continue. So by the end of the time when there is a severe Alzheimer's, the entire brain structure actually squeezes down, becomes more and more small. So all the functioning, everything which is their part of the function, they all get to diminish. Right? Some of the severe cortical functions are also affected, some of the ventricle functions are also affected. These are all the different parts where the processing happens. So of course memory is part of it, physical part, some of the functioning are also part of it. So they are all getting affected. We will see some of them like the memory loss, aphasia, apraxia, agnosia. These are the different terms where there is a mobility problem, where there is a cognition problem, where there is a communication problem. Slowly even the speech also gets affected. Disorientation. They are not able to identify where I am sitting right now. Right? Such things are happening. And then impaired executive functions. Some of the executive functions which are there, they are also getting impacted. So one is this a part of the cognitive, where there is a cognition also getting involved. Secondly, the non-cognitive, all the symptoms are the depression, psychotic symptoms like the hallucination. They feel that someone is calling them, even though they are just sitting alone. So there is a hallucination. And there are some behavioral problems. What happens with the old age? The generally person has some shift in the personality. They do the things differently in the old age. There is a possibility that there are some things that they are forgetting, but that is on and off.
They forget their wife first. Actually, this is what I've seen.
Yeah, in the later part of this kind of the disease, they forget the relationship. They think that their wife is their mother is someone else. They don't know the relation with the person. They don't know the face of the person. But it is interesting that the memory loss generally happens for the recent problems, for all the recent all the events. So आपने आज क्या खाया था? Last year हम कहाँ गए थे घूमने के लिए? आज का दिन कौन सा है? हम लोग अभी कहाँ बैठे हैं? Such problems, as the disease progress, such things are also washed out. But they will exactly know that in their childhood, which school they were studying, which streets, what were their friends' name. All such things are there. It is very well stored in so many of the cases. Even in the severe kind of a problem, that also may be affected. But in the middle, this developmental stage, even such functions are still maintained. Older functions, older memories are still there. So, one more thing. When you are talking to such people, they will ask you, hello, kaise ho aap? Aapka naam kya hai? You will tell your name. After a few minutes again they will turn to you. Oh, hello, how are you? What is your name? You will just not know what is happening. So, because there is a memory loss, they immediately forget what they have asked, who was here. So, such things are going on. There are stages in this. You must have seen sometimes in the movies. There were so many movies also on this topic, and it is very interesting to see how they are, picturizing this entire problem. And there are some functional loss. Functional loss means what? That their dressing. They are not able to understand that ये मैं shirt सीधा पहन रहा हूँ कि उल्टा पहन रहा हूँ. ये ये side का हाथ है कि ये side का हाथ है. They are not able to get. Even the pant they will sometimes wear the other way around. But because of the physical, all the effect, they may not be able to do that practice as well. So there is also possibility the bathing, the toileting, all this, they need some help after a certain time, because the brain is getting affected, right? So just for a simple idea, I have shown the early, mild, moderate and severe. Right? Early के अंदर क्या होता है? Memory loss, repeated questioning, then problems with the language. They are not able to get the exact word. So nowadays even you feel that the earlier generation get the similar problem. वो word याद नहीं आ रहा है, memory loss हो रहा है, etc. Depression is part of it, personality changes. So these are all the early stages. This is a very important stage for the understanding of the prevention aspect. That if the early signs are known, you can immediately try to work on it, and it can be, reverse back to maximum or the extent. Then the memory loss goes on, so they forget the date. To a longer, to the more depth, this memory loss goes on. Then unusual reasoning, जैसे मैंने बताया कि अरे आप कहाँ से आ रहे हो, वापिस वही का वही क्वेश्चन करेंगे. Confused, they get confused, the sleep is also disturbed, mood and behavioral changes. The rigidity comes, physical part also gets involved because the nervous system is getting affected. As the moderate change goes on, they are enabled to learn the newer things. Now, as we go on, we understand that some things give us a very, very important clue how to prevent it. जैसे कि inability to learn the new things, that means if after a certain age a person tries to learn newer things, newer games, newer people, newer anything that they want to learn, maybe music, art, or even the languages. Languages are a very, very good tool to keep the brain active. So part of the prevention program, what we do, we give them their some kind of kind of involvement in the activities. Like to play this board games, then some kind of a puzzle solving. Puzzle solving is also very good because that connection is getting re-established. When we are doing the yoga, sometimes we just observe that as the fingers are very, very well able to do the separate movement, the toes are not able to do. If you are trying, individual toe movement is very difficult. But if you see, sometimes those who have lost their arms or something, how they are developing slowly, they get exactly each and individual toe bending as well. Why that has happened? Why it is not possible in us? Because we have not used it. We have not challenged our body to that level. If we challenge, the neurons actually grow. They will grow entire new nerve, and that will supply all the toes individually, and that will again function. Like that in the old days, if we are challenging the mind enough that you have to do the puzzles, you have to do this, you have to do all the physical activity, then it can actually come back to the normal level. So the delusions and all keep on increasing where the moderate progress is there, and then unable to also know the family members and the friends, like just now sir has said. And then the severe condition, the total loss of verbal skills, they cannot almost speak, and they cannot also do their important basic things. The self-care is also there, not there. Then immobile, they become immobile, they cannot also swallow. These are all part of the nervous system effect. Then incontinence of the urine and the stool, that happens. Then hallucination and all keeps on increasing. So it is important that as the disease progresses, there is need of someone who knows how to help the patient. So there is a special training there, how to help these people, so that all the caregivers should learn it. For any those who are taking care of the elderly people, these are the general things. Like in the house, if you have somebody getting old, simple things are very important. Like there should be proper support in the bathrooms when there is a possibility to skip and to fall and all. So there should be some handles around. Then there should be proper numbering and board, means some kind of tagging over the cupboards, over what you have kept where, the filing. Simple things where they will be really help. This is the key for the room. just for an example, so you can also mark it that this is the room key. So simple things also they tend to forget. Even their own address, they should have their address in their pocket. They don't know their phone number. Sometimes they also forget that where they are belonging, names, everything. So such things are very important. And then also the visual impairment will be there. So things around like the entire cupboard is there. Then you put the handle of a totally different color. The steps edge should be having a different color. So that they actually know with even in the less light where are the steps, such things. And the spoon should be bigger so that they can even eat properly. Otherwise a small spoon everything spills over. Such basic care should be included as the disease progress. The diagnostic by the medical terminology is mainly by the patient history. क्या हो रहा है वो बोल के बता करके जब ये हमको पता चलता है, then the doctor knows that how there is a possibility of the problem. The family members and friends also they give the information. Then the laboratory tests are there. There are some tests which are indicating. Still, it is not confirmed in the medical terminology that they are always, helping in the right way. But vitamin B12 and folate deficiency are one of the main. Then hypothyroidism test. TFT is the thyroid function test. So all these functional tests will be also helping. Then other tests which are the brain जो छोटा हो रहा है, such kind of a test will be known with the PT, and there is the PET scan and CT. There is the topography test. So such tests where you see the tissue level changes, the actual size decreasing. That can be seen. For an example, you can see this complete edge of this entire brain. Over here, you can see the deformity, right? This area has also shrunk in a particular way. And this is also all the cells have changed their structure. So such things are actually visible in the test. Now let us come to the modern helping part. What I just now said, that some of the help that the modern physiotherapists, occupational therapists, what they can do. What others can do is one very important role of the psychologist. So in the initial time क्या होता है कि अभी आप बूढ़े हो रहे हो, वो सोच करके क्या होता है कि लोगों को acceptance में नहीं आता है. Then now I am getting old, now I am forgetting things. They don't know how to match the dressing. They can wear anything with anything, may wear, may not wear. That also happens. So that sensibility, that acceptance doesn't happen. Then they try to hide. There is a phase of withdrawal. Because social function में जाना ही पसंद नहीं करते क्योंकि उनको पता है कि उनमें कई सारा changes हो रहा है. So they want to avoid. Such things happen when there is a role of psychologist involved. What the psychologist does, they do a lot of counseling. They make them understand, they make the disease much more clear to them, the possibilities of preventing it in a more better way. So that is a very, very important phase. And then comes the physiotherapy, role of the yoga, then the all lifestyle diseases, whatever changes you can do in the lifestyle disorders. So that will be also very, very important. Part of it is also yoga. Apart from the basic yogic practices, okay, they are movement of entire body parts, right from the toes, means head to the toes. Everything, every joint should be moved properly, right? So there are some practices. Let us see first some advanced practices which will be most helpful to them. Now these are some of the scanned images. This is a Prasarita Pada Uttanasana, where the legs are spread. They are in exact parallel to each other, and then the head is brought down, right? The second practice is the Uttanasana. Uttanasana is a little modified form of the Hastapadasana. Hastapadasana is where the feet are together, then the palms are going down. In the Uttanasana, feet are separated little, and then the hands are brought down. When you are bringing the hands down, then the head is naturally more and more hanging down. That will increase the blood flow towards the head. As you see, the next is the Adho Mukha Svanasana, or there is another name called as Parvatasana. This is also one of the very, very good pose to work on the nervous system. Next is with the support of the wall. the same practice with the support of the wall.
So in the second practice, she's supported with some blocks
Yeah.
or something?
So, let me also tell you this, very important, that when you are doing the yogic practices, you know the asanas are there, but sometimes doing the asana with little help, some kind of a tools or props, that is really helpful. So what we use are the blocks. They are the small wooden lightweight blocks. Sometimes the cushions are there, sometimes the blankets are there, sometimes the ropes are there. Support. They are not, means she is just hanging down, and just for the resting of the head as a platform, there is some kind of a support. So these are the wooden blocks, and on that she is just resting the crown of the head. So with this resting itself, there is a lot of change in the asana, in that feeling in the asana, because as you rest, that activation of the brain centers is much more different. That is also felt when the person is doing. Now here, when the head is supported down, it is better. If you are not able to, supposing you spread your leg and bring the head down touching to the floor, what we do, we give you the support. Maybe on the chair you can place the head, or maybe a couple of pillows you keep and then you place the head. As you observe these changes, what we do normally is a workshop of 7 to 10 days for the Alzheimer's. And when they are actually doing it, they are able to perceive what are the changes because of such a simple help, right? Then let us see. This is the Paschimottanasana. Okay. Now Adho Mukha Paschimottanasana, where normally you would touch the toes, but the head is not able to rest properly. So we are giving them little support with some pillows on that, what they can actually place the head. Then is the Adho Mukha Virasana. Vajrasana is where the feet are touching together behind. Okay, they are touching and the toes are just together on the floor. All the 10 toes in line with each other.
Namaz.
In the
Namaz.
like they are doing the namaz. Very known pose, Vajrasana. But in the Virasana, the feet are separated and then they are sitting. But so many times nowadays there is a habit to sit on the chairs and the sofas only, all the time. So we have lost that flexibility in the ankles. So we give them some support below the buttocks or also below the ankles sometimes to make them more comfortable, and then they can place the head down. If there is a more tummy, then they are not able to even touch the head down. So we give them some pillow support. The same thing goes on for the Adho Mukha Swastikasana. Swastikasana is a simple sitting position with the leg. There is a particular like an angle or this kind of a placement. So over there also, what we want is the placement of the head down. It is very well supported and rested down. The same goes on. Here we have lifted the heels little. Now these are the simple finer changes that may occur. Means that actually when the person is doing, that time they can observe what are the changes in this as well as this simple kind of a Paschimottanasana poses. Then we continue with the Janu Shirasana. Janu Shirasana is a pose where one leg is extended, the other is bent and touched to the inner thigh, and then the person is trying to bend down, further extend and then catch hold of the toes. Then the head is also rested down. What happens that in this pose also, the spine, most of the poses you will see, there is involvement of the spine and the head. And the spine is also extended. Very importantly, it has to extend, and then the head also has to be placed and rested down. Then this is a pose where we have used the chair. So the chair is used where the head is resting down, and this is also very important, very effective pose. There is the Viparit Dandasana. Then Viparit Dandasana with the legs supported up. These are some of the poses which will increase further flow towards the brain. One of the very important asana is also the Shirshasana. Shirshasana, most of the people say that after a certain age, person should not do. But there are people, if they have kept a good lifestyle and a healthy diet and all, and if they are able to do with the help of the person, they should definitely go on for Shirshasana. It's a very helpful practice.
They say that people who have retina problems and people who have glaucoma, they should avoid it.
Yeah. I mean, there are so many conditions where they are strictly, suggesting not to go for Shirshasana.
CC,
Yeah.
high BP,
Heart disease, blood pressure, glaucoma,
glaucoma and
cervical problems,
Difference in the
yeah,
axis of your
vertigo.
eyes.
So many problems are there. But I'm saying those who are healthy otherwise, but having the old age as one of the only factor, or maybe with the help of the therapist, a properly trained therapist, they can make them do the Shirshasana in a simpler way. There are so many forms and possibilities of doing Shirshasana. So that is also one of the very, very good practice. Also there is Halasana.
Halasana.
Right? As you know, the Sarvangasana actually is done with the straight legs. The neck and the shoulders are down and the legs are straight up. Now we have found out so many variations with the chair. Now I am a practitioner of yoga, and since we are helping the old age patient as well for the Parkinson, we have made a 80-year-old lady also to do the Sarvangasana with the chair. And they are very, very well able to accept and do it. And they get so much of the effective outcome. So even the same way, after the Sarvangasana, you can also go for the Halasana. Halasana is the placing of the feet down towards the head on some other support. There is also Setubandh Sarvangasana. It's a different kind of a Sarvangasana practice altogether. And there is a Viprit Karni which is supported on the wall. Viprit Karni Mudra is a prior pose to the Sarvangasana sort of feel. So we have gone through certain practices which are, of course, on this thing you can see, but doing wise you have to do it very much properly with the care. What my aim was to guide you towards which are the possible practices and how the person should adapt them. Okay, so of course in all the practices there are all the do's and don'ts, the contraindications. So as per the individual case, if they are having heart problem and hypertension or some other problems also together with it, some of the practices may not be directly be done in a way. So all these practices which we have seen are generally applied for a healthy like an individual. So what I was thinking that we'll do some practices which will make you realize what is the effect of some of the yoga practices where there is more of the inversion. Okay, so
Sir,
can we just
can you show the fourth slide again one? That swastikasana with support. Yes, sir. Yes, right.
okay. So let us come to little practical part. Now whatever things you are just one more thing. Before we start with some practices, do you have any questions about what we have understood till now? Sometimes you have seen that in the television, people just see and they just start following up. But I don't know how much an individual should only look at the TV and just do it, because individual's capacity, their stage may be different. So for generally all the individuals to start with, they have to do it very, very slowly, right? So how it will go, as in you will always start with the left nostril for the Anulom Vilom, and you will always end also with the left nostril, because it is a cooling nostril and you want to end up and start with the cooling face, right? So what you will do, you will start with the left nostril, you will adopt this Nasika Mudra. Either you will place two fingers above the forehead and then you will continue to close and open the nostrils. So we start with the left nostril with the inhalation, very, very slow and comfortably deep. After we have inhaled completely, we close the left and open the right to exhale. Then you again start inhaling from the right. And then exhale from the left. So few things to be noticed. There is no movement of any other body part. There is no sucking effect. There is no kind of an exertion felt during the inhalation, also during the exhalation. It should be done very gently and softly. as you continue, your depth of the breathing may increase because of the calmness effect on the mind, on the breathing. Naturally, the depth will be more, right? But that should happen automatically and gradually. So, how many times to do this? We normally suggest that at least 3 times a day, person should do it for 27 rounds every time. So that 27 will take approximately 3 to 4 minutes or up to 5 minutes depending on the breath, the depth of the breathing. So you may take up to 5 minutes to complete 27 rounds approximately. So that will give a very very good effect, up to 5 minutes to do simple practice of Anulom Vilom. Second is the Anulom Vilom to be done in a half-off way. That is the Surya Bhedan and the Chandra Bhedan. Right? The Chandra Bhedan is what? You are inhaling from the left, exhaling from the right. Again you do the same thing. Inhaling from the left, exhaling from the right. This will be continued with the Surya Bhedan. That is inhaling from the right and exhaling from the left. That will go on for a particular amount of time. Maybe that can be continued for 2 minutes and 2 minutes individually. Now how it will help? As you know that when the person is having stroke, the opposite side of the body gets the effect. If the right side of the brain has got stroke effect, then the left side of the body will get the subjective effect. So similarly, there is a opposite side connection, right? Now when we are doing the activation, also the opposite side brain gets more activated. Now there are studies still going on to prove this fact, but there are enough the possibilities that have been seen that this activation goes on in the lab also. So what we are getting the clue is when we are doing this alternate nostril breathing, the opposite side of means both sides of the brain are equally getting that kind of a stimulation. So this is a very very good practice. Secondly, what as she was just now suggesting that the Brahmari Prana.
Because I have done with, should I say my experience, because I have done with a lady, she was 84 years old. I made it this only pranayam, and Brahmari pranayam, yeah, I used to do with her a lot, and holding her things with the rubber ends, count 10, release that, count 10, release that, and even the Bhumi Namanasana, she was sitting like this, and I am only getting her down herself, and she was just breathing normal. But there's 3 things I was doing with her also, but that has helped her a lot.
So now so many of the individual experiences also you will find that how yoga has helped. So one of that is the Brahmari. How you will do the Brahmari also? You are inhaling deeply, and then when the exhalation is there, you are making that honey bee or that bamboo bee sound with the exhalation. As long as a person can do. Generally, it has to be done with the closed eyes, and if possible, the closed ears and covered eyes. And the elbows are also lifted to breathe more deeper. So that goes on for about 12 to 15 times. It has got such a good effect on the brain cells that it actually does the massaging effect, the blood circulation, activation is there, and it gives overall calm down effect. Okay. Should we just try 3 rounds of Brahmari? How we will do it? We will inhale deeper, while we will exhale, we will make this sound. Okay, and you will do 3 times without opening the eyes in your own way. How much ever is your breathing, you complete the first round, go on for the second, go on for the third, right? Without any other instruction in between. So let us close the ears, the eyes, inhale deeply. So once you have completed, just rest your hands down. The closed eyes, observe that resonance, that after effect of the Brahmari Pranayama. Still we can feel some minute vibrations in the face, on the brain cells, around, everywhere. Then slowly opening the eyes. So there is immediate feeling of calming down. Immediate feeling of more restful. So such effect can be found even with simple practice called as the Brahmari. Now there are certain other practices which also help. One is the Kapalbhati, that will depend on the stage of the person, the problem, but that is also very helpful, right? How the Kapalbhati has to be done? That without too much of the movement of any other body part, person sits comfortably and does the stroke with the abdominal part only. How he will do? Will continue to give the stroke with the exhalation. Inhalation is left automatic. There is continuous stroke of exhalation, 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 exhalation goes on, and that goes on for maybe starting stage. It can be just done 30 times. One round 30 times. That's all. As the person becomes more experienced, he can increase to 60 and then stop. Up to 100 one can do. Generally, at this age, more than 100 will not be advisable. So the person does 30, stops, another 30, stops, maybe another 40, and that's all. Such way you can increase the number of rounds. But how it will help? Now there is a lot of inhalation in between naturally happening. So the oxygen level also rises, the carbon dioxide level also goes down. So there is more of enough amount of oxygen. After a phase, once the person is completing the number of rounds, there is a possibility that he feels completely thoughtless, or kind of a calming, like a standstill feeling is there, without the possibility of inhaling or exhaling. He doesn't want to inhale, doesn't want to exhale, doesn't want to hold even. Just in a standstill phase. The breathing may come in between and go as per the feeling of the body. It may take about 2 to 3 minutes to get back the normal breathing level. But that is a very, very important phase even in this Kapalbhati. So that is very important to observe that stage. Otherwise, Kapalbhati is also done, so many people are seeing in the television. That may not be that much correct, and they may not be doing it also correctly at home. So this phase should be very, very well observed, right? And then, of course, the deep breathing pranayams, they are all very, very nice. Any pranayam where there is deeper breathing involved, right? That should be done. Some of the mudras are very helpful. What I always suggest, one thing is this Gnan Mudra. Gnan Mudra is the index finger and the thumb touching, and the rest 3 fingers are straight. This is a very, very good mudra that increases lot of blood flow and lot of pranic movement towards the head. So it actually creates that channel in the brain to increase the pranic flow. We have done some practice like the mudra pranayam, where we keep the palms just open to the sky on the lap. And when we are observing the effect, lot of pranic movement goes upwards. Okay, let us have a small experience of this practice. When the palms are facing up, you just sit quietly and observe the effect, what is happening in the body. You will feel that much more awareness is concentrated in a particular area. So just sit with the palms open. If you want, you can even take a rest of the spine on the back side of the chair, or just sit erect and comfortable. Keep on observing the breathing. Relax your body and observe where the attention, the awareness moves in the body. We are becoming more aware of the upper body. We can observe. Naturally, so much of attention will move above the navel in the entire upper body as compared to the lower body. So to do any kind of a meditation or pranayama with the palms up will also be very, very much helpful. Let us continue to keep the eyes closed and just turn the palm down and observe what is the change. Still the eyes are closed, breathing is normal, body is relaxed. We are able to observe what change do we feel when the palms are facing down. We feel that now the attention, the awareness somehow has shifted to the lower body, below the navel. As if that part becomes much more lively and seeks the attention. That is the pranic movement that has shifted to the lower body right now. Let us again just turn the palm up facing to the ceiling at the same place and just observe the change. And then let us touch the index finger and the thumb together. Rest 3 fingers are still straight. And let us become aware of if there is any change that we can observe. This Gyan Mudra helps to increase the pranic movement towards the head, towards the brain cells. As if we are inhaling, and that energy from each and every inhalation goes directly to the brain. And let us slowly release the mudra and open the eyes. You can also do the palming if you want. Just to rub. Place the warm palms over the closed eyes and then move the palms over the entire face. So, could you feel some difference when we were changing? Right? So, there is some particular flow of energy. When we were doing this, was there any change further than just the palm straight? Right?
This is much more effective.
This is much more effective when we do the Gyan Mudra. There is actually a link felt. Now for this all, you have to be a little more sensitive enough to observe that subtle changes. But if you are able to observe, you will be able to appreciate that change. How that actually the pranic movement increases.
Some electric movement is going on.
Through the palm as well.
To this much, from backbone and.
Yeah. There is actually something which is felt. Now, as we go into deeper and try to observe, you can feel that more and more
For
connection.
people like that, even this prana mudra helps a lot.
Right.
With that mudra helps a lot because I used to do with that lady.
Yeah. So there is what just now she has also added there. There are some more mudras, like the first 2 digits are straight and the last 2 digits tips are touching to the thumb. It's a simple mudra called as pran mudra. That increases the pran, that is the basic energy, that is the shakti in the body. Yeah. So there are very, very live examples also we can see around. So it definitely gives a very, very good feeling and we are also trying out. So meditation, also I want to emphasize on that. What kind of a meditation can be done? Now, if you observe that there is already some cognition problem, if they are not able to understand what is happening, if you are not able to connect very well, then giving them simple instructions like the breath awareness. gives a very, very good effect. So it's a simple practice. The person either sits comfortably or just lies down and just starts observing what happens in the breathing. He is observing that he is inhaling and he observes that he is exhaling. Maybe after some time then he can become aware of the finer aspect of the breathing. That where does the breath touch when he inhales and when he exhales. Then further, what is the temperature of the air that he is inhaling and that he is exhaling. Then where all deeper level can he feel the touch along. Then what is the sensation inside the body when he will inhale. So as he keep on observing, he will be able to understand more and more deeper level. Now this connection with the body, the understanding and that feeling in the body is very important, because that connects more and more, that makes him more aware of the body. So the body and the mind, it is much more connected. So that neuronal joint will be developed and it will be much more in a healthier condition. So such meditations are also very important. Even there is a practice of this Yoga Nidra. Yoga Nidra is something where the person lies comfortably on a bed and then he is taken throughout the body. There is a tour. You go in the first phase, observe different body parts and make them totally relaxed. Then there is a phase of the Sankalpa, where you are giving a positive one-line affirmation which is designed for your problem. Now as per your need, you will form one simple Sankalp. A general Sankalp can be, I am all the time feeling happy and healthy and I am feeling better and better all the time. Now this is just a simple Sankalp. There can be different Sankalp or a positive sentence that can be formed. Then the next phase is the imagination. That the person is going through some of the imaginary scenes and phases. Then there is a feeling of opposites. So there is a opposite feeling of heavy and light, or maybe the awareness of bigger and smaller in the body. Such opposite feelings are also developed, hot and cold and so on. And then there is a positive perception, that you observe how you want to be, how you are normally acting, how you will be completely healthy. That kind of a picturization also can be done, visualization. And then again there is a Sankalp and then there is a relaxation phase. So this kind of a simple Yoga Nidra phases also can be planned. Okay? Ajapa Jap. Ajapa Jap is also a practice.
Very good.
Very, very good. So Ajapa Jap means what? A japa is taken and he is doing it in a, means like a oral way. Then he is continuously doing and bringing it to low tone. When that is continuously done, even when you withdraw the sound, the mind keeps on hanging with that sound. He keeps on doing that sound until a phase where the sound becomes almost constant going on till some amount of time. And that also has to be observed.
40 minutes.
Right. So that is also a beautiful practice. So there are so many meditative practices which are really helpful. So apart from the mudra, from the meditation and from the pranayam, I was talking about some of the physical practice, that is the asana. So let us do one or two asanas to observe what is the effect of this asana.
Now that we are on this, that vibration to the brain is important. Om chanting.
Yes.
It gives the maximum vibration to the brain.
Right.
So that Om chanting may also be of help.
Yes. Why I was not telling, just because of sometimes in the public lecture there are people of all the different sects and the religions. So I was avoiding that, but of course it is known that Om has got so many of the vibration and very strong effect on the nervous system. So generally Om is taken as one of the best mantra and it is used when one is chanting Om. There are different ways of chanting. Either the O and Ma part, generally it is done of 3 letters, O and Ma. But there are different phases and combinations that can be used, and that gives also different activation to the regions of the brain. Like more of A and more of Ma. As you change this kind of a percentage, the activation to the brain also will be changing. There are so many of the fine meditative techniques, even with the Omkar chanting. It's very beautiful. We have a practice called as the Nadanusandhan. Nada Anusandhan. When there is a Omkar or Uma, you join it together in a different variations and ways, and that will give the vibration into different parts of body. So very good practice, and very, one is enjoying that very well. So there are of course many of the practices. Let us quickly also go through some of one or two practices for the asanas. We have seen most of the asanas, but it is difficult to do it in this setup. But at least we will have some taste of the practice, how the inversions are helpful. Okay, so let us come up to the standing position. You can place the things around on the chair. You can create a little space in front of you. Okay, so that your head can have some space to bend. Little space for the head to bend.